Good afternoon, everyone, and welcome to Preventing Sepsis Part 1. This will be a 1-hour course today, and we will save some time for some Q&A at the end. Please take some time, if you haven't done so, to fill out the pre-session survey. I will have a colleague of mine put that in the chat. That was also emailed to you when you registered for this course. It's a quick poll, and it's required if you are looking to receive some continuing education credits for this webinar today. So while some people are still trickling in and completing the pre-session survey, I will take this opportunity to introduce myself. So my name is Allison Thurber. I'm a nurse at the Rhode Island Department of Health in the Center for Acute Infectious Disease Epidemiology, and I've been here for the past 7 years. About 5 years ago, I started with Project First Line as a training liaison, and I love working with this amazing team and seeing you all on Monday afternoons to refresh our infection control knowledge. I'm joined today by Dr. Alexis Kearney, our medical consultant for Project First Line Rhode Island. She'll be manning the questions throughout the webinar and the Q&A and joining me in the end for our live Q&A. If you'd like, Dr. Kearney, please come on and introduce yourself. All right, so here are the continuing education criteria for those of you who are attending and would like to receive CNE credit. This session is approved as one contact hour. This nursing continuing professional development activity is approved by the Northeast Multi-State Division Education Unit and accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. To receive your certificate of training, CE Dental IPC, or CEEMS, you will need to complete the following: the pre-session survey, attend the entire webinar, and the post-session survey. To receive your CNE credit, you will need to complete the following: pre-session survey, attend the entire webinar, and post-session survey, and a post-session quiz, which will be emailed to you with the post-session survey tomorrow. So let's go over our agenda. We just did our welcomes and introductions. So we will then move on next to learning objectives. We'll go over what is sepsis, sepsis burden and implications, sepsis prevention and identification. We'll have some poll questions at the end, key takeaways, and then we'll have our live Q&A. So our learning objectives for today's session are to describe sepsis and what causes it, to learn the signs and symptoms of sepsis and who is at risk, to understand how antibiotics play a role in sepsis infections, and to review infection prevention and control actions healthcare professionals can take to prevent sepsis. So before we fully jump into our materials, I just want to take a quick pulse check and get a feel for, everybody who is on this call and have you start thinking about sepsis in a more critical way. So first, we're just going to start by asking, have you taken care of a patient with sepsis? You don't have to answer in the chat, but just think about that. Have you taken care of a patient with sepsis? Think about the medications they were given. Think about how sick or maybe not sick they were. Think about the things that you were asked to do, tests that you were asked to perform, maybe education you were giving to this patient. And then, what do you think is the biggest barrier when it comes to effective sepsis care? So if you've taken care of a patient with sepsis, or you have a colleague who's taking care of a patient with sepsis, what is the biggest barrier when it comes to effective sepsis care? Maybe you work with children and identifying sepsis in your patient population is the hardest part about it. Maybe you are a limited resource workplace and you don't have what you need. Maybe you don't have the staff that you need. Maybe you don't have the technology that you need or the education that you need. So just think about that as we go ahead through this webinar. Okay. So we're going to start with CDC's Get Ahead of Sepsis campaign. So CDC's Get Ahead of Sepsis educational effort helps educate consumers and healthcare providers about the importance of early recognition and timely treatment of sepsis, reassessment of antibiotic needs, and prevention of infections. The Get Ahead of Sepsis educational effort seeks to optimize healthcare quality and patient safety by raising awareness and knowledge and motivating behavior change related to the prevention of infections that can lead to sepsis and early recognition of and appropriate treatment for sepsis among consumer and healthcare provider target audiences. So CDC Get Ahead of Sepsis campaign has many educational resources to use. And at the end of this presentation, we'll make sure that that is included in your resources that you can keep with you. So sepsis burden, a few facts for you just so we can understand how dangerous and how common sepsis is. So each year, at least 1.7 million adults in America develop sepsis. At least 350,000 adults who develop sepsis die during their hospitalization or are discharged to hospice. 1 in 3 people who dies in a hospital had sepsis during that hospitalization. Most cases of sepsis start before a patient goes to the hospital. Most people who develop sepsis have at least one underlying medical condition, such as chronic lung disease or a weakened immune system. And nearly a quarter to a third of people with sepsis had a healthcare visit in the week before they were hospitalized. So all of that gives you a lot of really helpful information. What is this is saying to me is that for folks who die in a hospital setting, sepsis is a very likely diagnosis that leads to death. It's also telling me that if you have an underlying medical condition, you are more likely to develop sepsis. And it's also telling me that when it says nearly a quarter to a third of people with sepsis had a healthcare visit in the week before they were hospitalized, maybe there's something we can be doing as healthcare providers to help decrease this sepsis burden by recognizing these sepsis risk factors and recognizing signs and symptoms of sepsis. So what is sepsis? All of that data to support how serious sepsis is, but let's go back a little bit and discuss what is sepsis. Sepsis is the body's extreme response to an infection. And make no mistake about it, it is a life-threatening medical emergency. Bacterial infections cause most cases of sepsis. Sepsis can also be a result of other infections, including viral infections, such as COVID-19 or influenza, or fungal infection. Infections that lead to sepsis most often start in the gastrointestinal tract, also known as your GI tract or gut, lungs, skin, or urinary tract. So how do we end up with sepsis? We mentioned sepsis commonly starts as a skin, lung, GI, or urinary infection, and then progresses. But how do people end up with the germ that ultimately leads to sepsis? So let's take a quick look at one of the underlying concepts of infection prevention and control. By understanding the 5 elements of how germs can spread, we can stop the germs from developing into initial healthcare-associated infections. So, what do germs need to spread? Germs need reservoirs, pathways, a person, body's defenses or breakdown of the body's defenses, and germ survival. So the germs need a place to live. They need a way to transport and get to that place, i.e., splashes and sprays, touch, breathing in. They need a susceptible host, a weakened immune system or breakdown in the body's defenses in order to get there, and germ survival. So when you have all of these, that's how infection begins. But if we manage to stop any one of these elements by following the infection prevention and control steps we all know and do on a daily basis, effective cleaning, disinfection, washing your hands, wearing PPE, using source control, covering wounds, etc. We as healthcare workers can help stop the infections. So, as healthcare workers, how do we identify sepsis? So, laboratory evidence, lab work helps. In labs, we may see elevated lactate levels, indicating a loss of oxygen in tissues within the body, abnormal white blood cell counts, indicating that the body is fighting an infection, elevated procalcitonin, evidence of bacterial infections, elevated C reactive proteins, indicating inflammation, or a positive culture with a known pathogen causing infection. The problem is that labs take time, especially cultures. And that is why it is so important to know the clinical signs of sepsis so we can react and treat swiftly. Clinical signs include high heart rate or a weak pulse, fever, shivering and chills, a change in baseline mental status, shortness of breath, pain or discomfort, and clammy or sweaty skin. So, if you were to ask me if you had to take home just a single slide from this presentation, this would be it. It is so important to know and be able to react to the signs and symptoms of sepsis so that we can prevent it before it gets too bad that it ultimately causes death. All right, so we are going to take a quick look at how sepsis affects the body. And this is a very broad view of how sepsis would affect the body. So, sepsis is the body's extreme response to an infection. It is life threatening, and without timely treatment, sepsis can rapidly cause tissue damage, organ failure, and death. So, again, very, very broad. But let's dive a little bit deeper and we'll use pneumonia for an example. So, if a pneumonia worsens or goes untreated, the bacteria can enter the bloodstream. Once bacteria enter the bloodstream, this causes the blood vessels to become leaky and dilated. So, dilated meaning they grow larger in width. And what does all this mean? This means that clinically, blood pressure drops. Your heart rate will increase, trying to work harder to pump the blood through the body. This will impede blood flow to the vital organs like your heart, your kidneys, your brain, and will lead to organ dysfunction, among many other processes happening in the body. So, who is most at risk? But some people are at higher risk. This includes people who are of older age 65 and older, and of younger age, children who are younger than the 1 year of age, people who are pregnant or postpartum, and people who have survived a sepsis infection in the past. People with chronic conditions such as diabetes, cancer, and kidney disease. People with recent severe illness and surgery or hospitalization, and people with weakened immune systems. So, sepsis treatment. Treatment for sepsis really varies depending on what tissues are damaged in the body and what symptoms the patient has. However, it always includes antibiotics. Research shows that rapid, effective sepsis treatment includes giving appropriate treatment, including antibiotics, as soon as possible, and maintaining blood flow to organs with fluid resuscitation, hemodynamic monitoring, maintaining perfusion, perhaps with some supplemental oxygen. Also, sometimes surgery is required to remove tissue damaged by the infection. Healthcare providers should treat sepsis with antibiotics as soon as possible. Also, really important to note that whatever facility you work in, you should know your facility's policies and procedures for managing sepsis, who you notify, how you notify them, how you treat. All of that should be in your facility's policies and procedures. So, antibiotic stewardship is something that comes up frequently with sepsis. So antibiotic stewardship, it's important to know, does not hinder efforts to improve the management of sepsis. Antibiotic stewardship programs play an important role in optimizing the use of antibiotics, leading to better patient outcomes. And it is possible for hospitals to make simultaneous improvements in sepsis management and antimicrobial stewardship. Antibiotics are really critical tools for treating infections, including those that can lead to sepsis. However, as antimicrobial resistance spreads, infections are becoming more and more difficult to treat. Antibiotic side effects range from minor, such as rash, dizziness, nausea, diarrhea, to severe health problems, such as life-threatening allergic reactions or C. difficile, an infection that causes diarrhea and can lead to colon damage and death. However, when antibiotics are needed, the benefits much outweigh the risks of side effects or antimicrobial resistance. So improving the way healthcare providers prescribe antibiotics and the way we take antibiotics helps keep us healthy now, helps fight antimicrobial resistance, and ensures that these life-saving drugs will work for you and others when they're needed most, like for treating infections associated with sepsis. All right, so let's get into infection prevention and control actions, things that we can do as healthcare workers to prevent sepsis. All right, so a few things that we can do to help prevent sepsis. So first, perform hand hygiene. And we're going to dive into each of these actions on their own slides next. Aside from hand hygiene, we can also help prevent healthcare-associated infections that lead to sepsis. This includes appropriate indwelling medical device management, oral care and proper positioning, and appropriate skin and wound care. We can adhere to standard transmission-based and enhanced barrier precautions. We can recognize and communicate the signs and symptoms of sepsis. And patient and family education. It's very important for patients and families to know the signs and symptoms and how to get critical emergent care if they do recognize the signs and symptoms of sepsis. All right, so performing hand hygiene. Cleaning your hands reduces the potential spread of deadly germs to patients. The spread of germs, including those resistant to antibiotics, and the risk of healthcare personnel colonization or infection caused by germs received from the patient.
Implementing a hand hygiene program that's rooted in the 4 E's: engage, educate, execute, and evaluate is a great way to get your healthcare facility on the path to continuous quality improvement. In this second video of our 4-part series, we'll cover another essential facet of an effective program: educating your healthcare personnel. When healthcare personnel clean their hands the right way at the right time, they have a direct impact on the health and well-being of those receiving their care. It is important that healthcare personnel have training so that they recognize times when hands should be cleaned and that they always clean their hands thoroughly. The hands of healthcare personnel should be free from redness, cracking, or wounds, and they should have short, natural nails. Fingernails should not extend beyond the fingertip. Some healthcare personnel, like those that scrub for surgical procedures, should not wear fingernail polish. If polish is permitted, it should not be chipped or flaking. Hands should be cleaned immediately before touching a patient. Before performing an aseptic task, like inserting a catheter or handling invasive medical devices. Before moving from work on a soiled body site to a clean body site on the same patient. After touching a patient or the patient's immediate environment. After contact with contaminated surfaces, blood, or other bodily fluids. Immediately after glove removal. Alcohol-based hand sanitizer is preferred for hand cleaning in most clinical situations. Hands should be washed with soap and water whenever they are visibly soiled, before eating or helping someone eat, and after using the restroom or helping someone with toileting or changing a diaper. To sanitize your hands, begin by dispensing a palmful of sanitizer into your hands. Make sure that you get enough to cover all surfaces of your hands. To accomplish this, you might have to activate the dispenser more than once. Your hands should stay wet with alcohol-based hand sanitizer for at least 15 seconds while you rub them. Begin by rubbing your palms together, covering the front and back and in between your fingers. Make a rotating motion for each thumb. Finally, rub the fingertips in the palms of each hand. When washing your hands, be sure to use warm water, not hot water. The method for hand washing is very similar to hand sanitizing. Begin by rubbing soap in your palms and cover the backs of your hands. Make sure to scrub in between your fingers, your thumbs, and your fingertips. You should scrub your hands for a minimum of 15 seconds, but the entire process may take up to a full minute. Once clean, pat your hands dry with a disposable towel. Avoid rubbing, which can irritate your skin. Finally, use a disposable towel to turn off the water. Some germs are hard to kill with hand sanitizer and may also be hard to remove with hand washing. Gloves can reduce hand contamination, but germs can hitch a ride on gloves, so they should be changed during care when you complete a soiled task and move to a clean task. Any item you touch while wearing used gloves may become contaminated. Pay attention to how you remove your gloves so that you don't contaminate your hands. To remove your gloves, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Peel downwards, turning the glove inside out. Remember, the use of gloves does not replace the need to clean hands. If gloves are worn while providing patient or resident care, and you do a task where you would normally clean your hands, then you should stop, remove your gloves, and clean your hands. Remove gloves carefully and always clean your hands immediately after removing gloves. The hands of healthcare personnel can be damaged by excessive exposure to soap and water and by use of gloves. Protect the skin on your hands by using facility-approved hand lotion before you start your day, after hand washing, and after you clean your hands at the end of the day. Make sure the skin on your hands is healthy so that you can give the gift of health to those who receive your care. For more information about hand hygiene, watch the remaining videos in this 4-part series or visit our website at cdc.gov/handhygiene.
All right. So we just finished watching a 5-minute video on all things related to maintaining and cleaning your hands. And cleaning your hands has come up in almost every single webinar we've presented over the last 5 years, if you've been following us for the last 5 years, and for good reason. It is an effective and one of the most effective ways to prevent the spread of infection. Cleaning your hands, again, reduces the spread of deadly germs to patients, the spread of germs, including those resistant to antibiotics, and the risk of healthcare personnel colonization or infection caused by germs received from the patient. All right, so our next IPC action is preventing healthcare-associated infections, and included in that is appropriate indwelling medical device management. Indwelling medical devices refer to peripheral venous catheters, central venous catheters, and urinary catheters. Before any procedure, the staff performing the task should evaluate the indication and the potential risk associated with the device use. The device placement should follow proper insertion technique according to hospital policy and manufacturer guidelines. Use appropriate securement devices. Maintain clean and intact dressings on peripheral venous catheters and central venous catheters. Remove devices as soon as they are no longer needed or when a complication is identified. And evaluate the device daily for necessity. This will reduce unnecessary use, thus reducing the infection risk. So then under preventing healthcare associated infections, we also have oral care and positioning. So this IPC initiative specifically addresses reducing the risk for hospital-acquired pneumonia, which can lead to sepsis. Oral care within healthcare facilities is important to help decrease the risk for pneumonia, especially in patients who have decreased mobility, are utilizing a ventilator, or are post-op. Positioning and frequent repositioning also plays a large role in pneumonia prevention. The elevation of the head of the bed to a semi-recumbent position, meaning at least 30 degrees high, is associated with a decreased incidence of aspiration and ventilator-associated pneumonia, also known as VAPS. It's also important to practice breathing exercises with incentive spirometry and early mobility, such as ambulation, post-operatively, to help decrease the risk for healthcare-acquired pneumonia. And last, we have wound management. So using aseptic technique when handling wounds prevents introducing bacteria into the wound bed. Healthcare professionals should wash their hands thoroughly before and after each wound care session. Wearing sterile gloves during wound cleaning and dressing changes reduces the risk of contaminating the wound with external bacteria. All right, so our next infection control prevention action is adhering to precautions. So, standard precautions. We would use standard precautions for all patients. Standard precautions apply to all patients regardless of infection status and are aimed at protecting the caregiver from potential blood, body, fluids, and secretions. Key elements of standard precautions include hand hygiene, safe handling of sharps, PPE use, coughing and sneezing etiquette, appropriate waste and laundry handling, and reprocessing of reusable patient care equipment. And then we have transmission-based precautions. So we apply transmission-based precautions for patients who may be infected or colonized with certain infectious agents, for which additional precautions are needed to prevent transmission via healthcare worker indirect contact or contact with other patients. And then we have our individual breakdown of transmission-based precautions. So we would apply contact precautions for patients with pathogens that can be transmitted by direct or indirect contact via touch. We would apply droplet precautions to patients and with pathogens that can be transmitted via splashes and sprays. And we would apply airborne precautions to patients with pathogens that can be transmitted via breathing in. And then we have enhanced barrier precautions, and those are known for people who are known to be colonized or infected with an MDRO or have an indwelling medical device that leaves them more susceptible to MDRO acquisition, so drug-resistant organisms. It's important to communicate precautions with team members, make supplies easily accessible, and know how to don and doff appropriately to avoid the spread of infection. So if you don up and you take care of a patient who is on precautions and then you take off your PPE incorrectly and you happen to contaminate yourself, all of that work you did donning up and taking care of that patient has gone to waste because you've then contaminated yourself. So one of our other IPC actions is to be able to recognize and communicate signs and symptoms of infection. A person with sepsis might have one or more of the following signs and symptoms: clammy or sweaty skin, confusion or disorientation, extreme pain or discomfort, fever, shivering, or feeling very cold, high heart rate or weak pulse, and shortness of breath. It's important, and I cannot stress it enough, to know the signs and symptoms of sepsis. Healthcare personnel should immediately recognize the symptoms of sepsis and communicate them with the care team so that the care team is able to act swiftly and create a plan. Monitor patients identified with signs and symptoms of sepsis closely. Early and frequent reassessment of patients with sepsis should be taken to determine antibiotic effectiveness and further progression of symptoms. And lastly, we have education, specific to patients and families. So as medical professionals, any patients that are at risk should be educated on the signs and symptoms of sepsis, as well as sepsis prevention while in the hospital and upon discharge, so they can continue these concepts while healing at home. So the concepts that staff should be teaching, and this is not all inclusive, include that sepsis is a medical emergency. You should be educating the patients on the signs and symptoms of sepsis and when to seek care. How to prevent infection, like hand hygiene, a clean environment, at-home device management. You should be teaching patients and families how to keep cuts and wounds clean until healed. And teaching them about chronic disease management. So improperly or unmanaged chronic diseases like diabetes can increase the risk of infections leading to sepsis. Also, vaccines are a really important part of sepsis education. Vaccines can prevent infections that may lead to sepsis. And again, teaching patients that if they or a loved one have an infection that's not getting better or is getting worse, to act fast and get medical care immediately. All right, so we're going to end out with some poll questions. So I would like you to please think of this answer. Is it true or is it false for this first one? So antibiotic stewardship hinders the success of sepsis programs. Is that a true statement or is that a false statement? So this one is false. Antibiotic stewardship does not hinder efforts to improve management of sepsis. They play a really important role in optimizing the use of antibiotics, leading to better patient outcomes. And it is possible for hospitals to make simultaneous improvements in both sepsis management and antimicrobial stewardship. Next, who is at risk for sepsis? Think about what we went over in our webinar. Think about who may be most at risk for sepsis. Who's most at risk for getting infections? Who's most at risk for becoming ill? So that includes adults 65 and older, so those of older age, or children younger than 1 year of age. People who are pregnant or postpartum, and people who have survived sepsis, meaning they've had an infection that has led to sepsis in the past. People with comorbidities and chronic conditions such as diabetes, lung disease, cancer, and kidney disease. People with recent severe illness, surgery, or hospitalization, and people with weakened immune systems. Those who are undergoing chemo, perhaps, for cancer, or take high-dose steroids. Those are folks who have weakened immune systems. All right. So another true or false question. Early detection and timely treatment are essential for survival and limiting disability for survivors of sepsis. Is this true or is this false? So this one is true. Sepsis requires swift recognition and treatment so it does not worsen, leading to organ dysfunction and at times, unfortunately, death. Early detection, timely treatment, recognition of signs and symptoms, those are all so important with sepsis. Right. And last poll question I want you to think of. What are signs and symptoms of sepsis? Again, you may remember on our signs and symptoms slide, I said, if you could take away one slide, please take this away. What are the signs and symptoms of sepsis? If a patient had sepsis, would you recognize these symptoms? So, clinical signs include high heart rate or a weak pulse, fever, shivering and chills, change in baseline mental status, shortness of breath, pain or discomfort, and clammy or sweaty skin. All right, so let's go over our key takeaways for today's webinar. Key takeaways. Sepsis is the extreme body's, well, let's start again there. Sepsis is the body's extreme response to an infection. It is life-threatening medical emergency. Recognizing the signs and symptoms of sepsis rapidly can decrease the severity of the infection and allow for better patient outcomes. Every healthcare worker plays an important role in preventing sepsis and adverse outcomes of sepsis. Rapid treatment is key to survival, and healthcare-associated infections leading to sepsis can be prevented using infection prevention strategies that we've gone over in this webinar. All right, so I would like to remind everyone that there are a few requirements to receiving your certificate of training that we went over quickly at the beginning. We'll go over in a little more depth right now. In order to receive your certificate of training, you must complete our pre-session survey, participate in today's Zoom webinar, and complete the post-session survey. A link to the post-session survey will be emailed to you tomorrow on May 19th and will be available until May 26th at midnight. Once you complete the requirements, our certificate of training will be emailed in PDF form on May 29th. For EMS and dental providers, this can be used towards 1 hour of continuing education credit. Please be sure, if you're looking to receive CNE credit, that you complete the pre- and post-session survey and also the post-session quiz. That will be emailed to you tomorrow. This afternoon, the post-training resources and this PowerPoint will be emailed to all who attended today's session. All right, so future training sessions, we have the second part of this webinar titled Core Elements of a Sepsis Program, going live on June 1st. It will be presented by myself and will be Project First Line Rhode Island's 100th and final webinar. This webinar is great for leadership of healthcare facilities looking to create or improve a sepsis program. And we will be again offering one continuing nursing education credit for this webinar as well. If you still need to sign up, please follow the link that we are adding to the chat, and I absolutely look forward to seeing you there. If you did not enter your email earlier in the chat, please feel free to enter it now to be added to our distribution list of upcoming trainings. You can also email Project First Line directly if you have any questions, and click on our live events link through our webpage. Abby will post this into the chat as well. This is how you will reach us and how you can look up all our events that are coming up if we're hosting any webinars. You can also follow Project First Line on social media. Follow us on YouTube, Twitter, Facebook, Instagram, and LinkedIn. And these are the references for today's session. I invite you to please take the 3-question poll on your screen. This helps us to improve future sessions and assess community learning needs. So I'll give you a moment for the end of session feedback, and then we'll move on to our Q&A. All right, and now I will invite Dr. Kearney to come back and join me for our live Q&A, and we will go over any questions that you have. Please put your questions in the Q&A box so that we can answer them. I would like to thank you all for joining us today. I hope that you learned something that you can take with you onto the clinical setting, that it was helpful and applicable, and we look forward to seeing you soon. Thank you.